Okay. Alright. So we have enough time for a few more questions. And I've been handed two. So this first one is really a two-part question. As I almost fall down. Alright. Who asked this? You? Okay. What is fatigue and what is chronic fatigue syndrome? Okay. Fatigue and chronic fatigue syndrome aren't the same thing. So first of all, we'll separate them into two questions. What is fatigue? What is chronic fatigue syndrome? Fatigue is a symptom, but it's also a sign. It means quite a bit. It's both subjective and objective. So what does fatigue mean? To a lot of us, fatigue means lack of energy. Mental fatigue, mental exhaustion is another thing it might mean. To some people, fatigue is equivalent to depression. To some people, it's all of the above, and often in a dynamic way. When you have fatigue, you get depression. When a lot of people see it as not enough spoons. If you've read we've gone over what a spoonie is, but you can't do enough tasks. You only have so many tasks, or delayed recovery. Also, it could mean impaired muscle endurance, muscle fatigue, neurological fatigue. So let's go through those again. What does it mean to have fatigue? Well, for people that have good health, lack of energy. My allergies are bringing me down. I'm a little fatigued. Or for someone who's run themselves into the ground, maybe mental fatigue or exhaustion. Now, those two things can also happen with people that are ill, but it may mean a lot more. You could have depression on top of those things. When you have neuromuscular illness like myasthenia gravis, chronic fatigue syndrome, or certain neuromuscular disorders, or mitochondrial myopathy, you may have impaired muscle endurance. You literally have fatigue ability of your muscles. They don't work right. They may have impaired activation, or they aren't activated appropriately from nerve disease or neuropathy or a central nervous system disorder. They may have abnormal metabolism and not be able to work at full function, or they work dysfunctionally. But you can have impaired muscular endurance and impaired neurological endurance and impaired neurological function from both central nervous system disorders, nervous disorders, neuromuscular junction disorders, and muscle disorders. Okay, so multiple sclerosis has a impaired neurological dysfunction resulting in fatigue. Neuropathies have that. Myasthenia gravis is famous for that in neuromuscular junction. Chronic fatigue syndrome has this. Neuromuscular disorders, mitochondrial myopathies, all kinds of myopathies, autoimmune disorders, all of them have a reason for fatigue. Now, there's also delayed recovery, which I see in stroke patients, but I also see in autoimmune disorders, and we don't understand the delayed recovery necessarily, but I thought it was put very well when we talked about what a spoonie is. If you give up 4 spoons one day and you only have 3, you're borrowing from the next day. Okay? Okay. So that's my answer about what is fatigue. It is real, it is neurological, it is muscular, it is neuromuscular junction, it also is central nervous system, it also has other dynamic features. It's a very big subject. That's why we do a whole seminar on it in Triumphed Over Pain, as I give myself a marketing plug. Okay. Chronic fatigue syndrome is a medical condition characterized by persistent fatigue and other specific symptoms that last for at least 6 months in adults. And I think it's 3 months in children or adolescents. The fatigue is not due to exertion. It's not relieved by rest. It's not caused by other medical conditions, and that's important because most of the time I've seen people that have chronic fatigue syndrome, I've ended up diagnosing them with something other than chronic fatigue syndrome, and we'll go over differential diagnosis in a second. Chronic fatigue syndrome is also referred to as myalgic encephalomyelitis, or ME, post-viral syndrome or post-viral fatigue syndrome, chronic fatigue immune dysfunction syndrome, or there are several other terms. Biological, genetic, infectious, anti-inflammatory, and psychological mechanisms have all been proposed. I think it's dynamic, but the etiology is not well understood. It may have multiple causes. I personally think it's a neurological immune endocrine dysfunction, but I don't know exactly where it starts. I think there's a predisposition. Currently, it's important. It's a diagnosis of exclusion. You rule out things that are treatable in other ways other than this one's really just a symptomatic treatment. You can treat chronic fatigue syndrome. Symptoms of chronic fatigue include really tired after exertion, unrefreshing sleep, widespread muscle and joint pain, but not fibromyalgia. Sore throat, headaches, not previously experienced before the chronic fatigue syndrome, cognitive difficulties, widespread mental and physical exhaustion, muscle weakness, sensitivity to light, sensitivity to sound, smells. These people are typically very sensitive to everything. Migraines, orthostatic intolerance, digestive disturbances, irritable bowel syndrome, depression is a common mood disorder. Of course, it would be if you have chronic fatigue. I mean, it's going to be a common reaction as well as a common symptom. They usually have swollen lymph nodes. Sometimes the cytokine levels and inflammatory proteins will be elevated. There's cardiac and respiratory problems. It's unclear if some of these are comorbid or if they're produced by the chronic fatigue syndrome. When you see a chronic fatigue patient, you typically get this autoimmune disorder feel, but everything comes back negative and they don't meet the fibromyalgia criteria. Estimates range from 7 to 3,000 cases to over 100,000 adults. I think there's about 1 million Americans thought to have it and 250,000 in the UK. It's more often in women than men. It's a problem that I've seen, and most of the time I've been asked to consult, I've ended up finding other things that weren't diagnosed. So myasthenia gravis, neuropathy were two of the ones that I diagnosed. Sleep disorders, autoimmune disorder with depression, mitochondrial myopathy, multiple sclerosis, transverse myelitis, arachnoiditis. A lot of people are also sometimes come in and they say, oh, I have chronic fatigue syndrome, fibromyalgia syndrome, which, a lot of people that have fibromyalgia have chronic fatigue, but the presence of the abnormal pain responses to mild stimuli and excessive tender points is a difference between fibromyalgia and chronic fatigue, although the two diseases may co-occur. I typically see people with either fibromyalgia or chronic fatigue. So it's important to find the absence of biochemical, metabolic, and neurological and muscular abnormalities. I have only seen 2 chronic fatigue syndrome patients after we did the full workup, including muscle biopsy, neuropathy workup, etc. And I think I've been sent probably 100 people that were said to have chronic fatigue syndrome. including I saw one that was post-polio syndrome and one that was multiple chemical sensitivity post-Gulf War. So I think it's relatively rare. I think a lot of people probably go undiagnosed with other things, but it does exist, and I'm not sure what it is. It's one of those I don't know disorders. I think the immune system is definitely involved, the neurological systems are definitely involved. There's inflammatory responses, and I always get the feel that it's kind of an autoimmune disorder, but I don't know what it is, and that gives you limited treatment. There's medications, there's graded exercise therapy, there's cognitive behavioral therapy, there's improved exercise tolerance. There's things you can do for it. But I want you to understand, it is a disorder. There are many disorders that mimic it, and fatigue is a symptom and sign that is part of this disorder, but it's a part of many disorders. Fatigue is the second most common thing I have complaints of after pain. Pain and headache number 1, fatigue number 2. That's what we see mainly on the website too. So I hope that answers the question. We do a dual seminar on this in Triumph Over the Pain series, and I think we're having 2 free seminars, one in October and probably one in November, on fatigue, and we'll go with feedback on what everyone wants. If you want to discuss chronic fatigue syndrome more and fatigue less, we can. We usually go with what the people that are at the seminar want to do, and these are going to be teleseminars. One's going to be a local seminar, one's going to be a teleseminar. So the teleseminar I believe is free, and I don't have the date for that on, but you can look on the website or the Facebook site, My Chronic Pain. All right, take care. Thanks. One more question? Okay, let's get to that one, and then we'll be done.